Welcome to page 157 of Anatomy Coloring Book. This is Dr. Stephen Harkins. The male urogenital structures. We've already discussed the path of the Ductus Deferens from the epididymis and the testes up, around, down behind the bladder, and into the prostate. Where it joins the urethra. Well, the part of the urethra that it joins is called the prostatic urethra. Of course, running through the prostate gland. And so you might wonder how during ejaculation, why doesn't any urine enter the urethra? Well, there's a little muscle here that contracts and blocks off the passage of urine into the urethra, into the prostatic urethra at that time. The second part of the urethra is known as the membranous urethra. It is after leaving the prostate gland, the urethra enters the membranous little section here where it passes through some soft tissue called the urogenital diaphragm. It's it passes through both the pelvic diaphragm and the urogenital diaphragm, which we'll talk about in a moment. Then it is renamed the spongy urethra. The spongy urethra, as it passes through this area of what is called the corpus spongiosum of the penis. So those are the names of the urethra, the three names of the urethra as they pass. The same tube is passing through different areas. And that's the spongy urethra. Now, the penis itself, the penis has a couple of spongy cavernous tissues, one called the corpus cavernosum, which is this structure here. And it is cavernous, like a cave, in that it has lots of space in it, lots of empty space in it. And moving down here, that's the corpus cavernosum. And then moving towards the base of the penis, takes on a different name called the crus of the penis, or the crus of the penis, in this lower area here. I'll make little crosses to define the crus of the penis. And it is cavernous and spongy, and what happens is it is that way so that blood can be infused in the little caverns of the corpus cavernosum in order to become erect. Now, behind the corpus cavernosum is the corpus spongiosum of the penis. And the corpus spongiosum is this area here. And it, like the corpus cavernosum, is, well, spongy and cavernous. In other words, it can be filled with blood. It's got a lot of extra space to be filled with blood. Now, there are parts of the corpus spongiosum, the bulb of the penis, which is back here, still part of the corpus spongiosum. And then the glands of the penis. So they're named differently because of their structure. One's their position. One is over here, the cavernosum is sort of superior on top, and the spongiosum is on bottom, and the spongiosum is the part that the urethra runs through. So the urethra does not run through the corpus cavernosum. It runs through the corpus spongiosum, through the glans, penis, and the bulb and the glands. Lastly, this structure here is the prepuce. This is the foreskin of the penis, which is often removed during circumcision in some religious practices. Now, some related structures surrounding the corpus spongiosum and cavernosum are layers of fascia. We have here's the skin here, and underneath we have a layer of superficial fascia and a layer of deep fascia. Deep fascia and superficial fascia. Superficial fascia, and then of course the skin on the outside. Lying within the superficial and deep fascia are veins and arteries, as described below here. For veins, let's use blue. There are veins, which is here, veins, and there are arteries. I'll put them in red. And here's a deep artery here inside the spongiosum. And notice that there are two corpus cavernosum and one corpus spongiosum. So deep within the corpus cavernosum, we have a deep artery, as we can see right here in the corpus cavernosum. And here again, artery. We also have nerves running through. We have nerves for stimulation running through the superficial and deep fascia of the penis for sensation and neurologic feedback and stimulation. Now, something very interesting happens to create when the penis fills with blood. The penis fills with blood through these arteries, of course. But what happens as the corpus cavernosum and the corpus spongiosum fill with blood, fill completely with blood, what happens is these veins that are inside in the corpus spongiosum, the veins here and wherever they are inside, they become compressed because the nervous system, parasympathetic nervous system, dilated these blood vessels and said it's time to engorge the penis with blood. And when that happens, as you can imagine, as this area fills with blood, the corpus cavernosum and spongiosum, it flattens out the outer area. The outer area becomes flattened, and what happens is these veins become squished. These veins become squished because of the pressure. They become flattened out. They come from a circular to a flattened, and the blood cannot escape from the pressure. The fluid pressure going outward squashes the veins so that blood cannot escape back to the body and to the heart. And that is how the penis is able to stay erect. So here we have the nerve there. Now, how is the penis connected to the body? Well, it's connected in two ways. First, the corpus cavernosum from the crus of the penis is connected directly to the pubic bone right here. While the corpus spongiosum is also connected, but it doesn't connect to the pubic bone. It connects to this area called the urogenital diaphragm. So it's connected by fascia and soft tissue right in here. And for a sagittal view, you can see this area, the pelvic diaphragm, right here. And notice there are two layers, soft tissue layers, that the urethra has to come through. This pelvic diaphragm right here, or excuse me, yes, the urogenital diaphragm right here, which attaches from one pubic bone to the other. Then it has to pass through another layer called and that was the urogenital diaphragm, has to pass through another layer called the pelvic diaphragm. This is a group of muscles, levator ani muscles, that when they contract, they can lift the pelvic diaphragm upward, and when it relaxes, downward. But here we have the urethra, and once again, the prostatic urethra through the prostate from the bladder. Then the passing through the membranous urethra, these two membranes is the membranous urethra, passing through the levator ani, the pelvic diaphragm, and the urogenital diaphragm. Then we rename it the spongy urethra, passing through the corpus spongiosum. And the levator ani, the pelvic diaphragm, right there underneath the prostate gland. And of course, here we have the bulbourethral gland, which is going to put that lubrication before ejaculation, right here, that lubrication before ejaculation into the spongy urethra. This has been page 157 of Anatomy Coloring Book. This is Dr. Stephen Harkins.